Welcome to the Medicare Fraud and Abuse Prevent, Detect, Report course. About the course. This course educates healthcare professionals about how to prevent, detect, and report Medicare fraud and abuse. Healthcare fraud. Although there is no precise measure of healthcare fraud, those who exploit federal healthcare programs can cost taxpayers billions of dollars while putting beneficiaries' health and welfare at risk. The impact of these losses and risks magnifies as Medicare continues to serve a growing number of beneficiaries. Do your part. The federal government aggressively cracks down on fraud and abuse, but it needs your help. All healthcare professionals must do their part to prevent fraud and abuse. Please note, the information in this course focuses on the Medicare FFS program, also known as Original Medicare. Many of the laws discussed apply to all federal healthcare programs, including Medicaid and Medicare Part C and D. See Job Aid C for information on fraud and abuse in Medicaid and Medicare Part C and D. Do your part. Get informed. Committing fraud is not worth it. The DOJ opened 918 new civil health care fraud investigations. Medicare Trust Fund recovered approximately $1.2 billion. $232 million were recovered in Medicaid federal money transferred to the Treasury. The federal government convicted 497 defendants of healthcare fraud. Department of Justice, or DOJ, opened 1,139 new criminal healthcare fraud investigations. What are the consequences? HHS OIG criminal actions for fiscal year 2016, 756. For fiscal year 2017, 766. Fiscal year 2018, 679. HHS OIG civil actions for fiscal year 2016 were 690. For 2017, 818, and for fiscal year 2018, 795. Course objectives. After completing this course, you should correctly recognize Medicare fraud and abuse prevention methods, recognize how to report Medicare fraud and abuse, recognize entities that detect Medicare fraud and abuse, identify Medicare fraud and abuse provisions and penalties, and identify what Medicare considers fraud and abuse. Course overview. This course consists of 5 lessons. Lesson 1, Medicare Fraud and Abuse, explains fraud and abuse basics. Lesson 2, Medicare Fraud and Abuse laws and penalties, outline the laws and sanctions used to fight fraud and abuse. Lesson 3, Physician relationships with payers, other providers, and vendors, describes methods to prevent Medicare fraud and abuse. Lesson 4, Medicare Anti-Fraud and Abuse Partnerships and Agencies, identifies the entities charged with detecting Medicare fraud and abuse. Lesson 5, Report Suspected Medicare Fraud and Abuse, describes how to report suspected Medicare fraud and abuse, how to self-disclose violations, and the rewards available for reporting fraud and abuse.